Mpox, formerly known as monkeypox, has re-emerged as a significant health concern in Africa, with Nigeria being one of the affected countries. The World Health Organization and the Africa Center for Disease Control have declared the ongoing Mpox situation a public health emergency of international concern. As of August 2024, Nigeria continues to monitor and manage the situation to prevent a large-scale outbreak. Hello and welcome to Healthy Living on Trust Television. I'm Aisha, Salihu, and today on Healthy Living, we're focusing on the current Mpox in Nigeria. We'll still explore the latest statistics, symptoms, transmission, treatment, prevention, and so much more. Joining us today to talk about it is Dr. Amina Ahmad-Shehu, a public health expert and a founder, CEO, Opti Health Consults. Thank you so much for joining us on the program, Dr. Amina.
Thank you very much, Aisha. Thanks for having me.
In August 2024, Nigeria reported 39 confirmed cases. These figures contribute to the broader African statistics, where over 2,030 cases have been confirmed, with the Democratic Republic of the Congo being the hardest hit. Now, Dr. Amina, as a medical practitioner, can you tell us, a 5-year-old, what Mpox is?
Okay, thanks, like I said, for having me, Aisha. So Mpox was the same disease that was formerly known as monkeypox. And it is a viral disease that has been around for more than 50 years, actually. And when I say viruses, so viruses and bacteria are infecting agents, for those who don't know. And there are many, many different types of viruses. So this is a particular type of virus, very closely related to the smallpox virus. As you might know, smallpox has been eradicated for many years now. So it's been around, and it was, and there are two different types of viruses that cause monkeypox. You have the clade 1 and the clade 2. So basically that just means that one of them is more likely to cause really serious disease, and that's the one they have in the Congo region. And the one we have here in West Africa and Nigeria is mostly the clade 2, which although causes serious disease, but is not as deadly as the clade 1.
But then how would you describe the current status of Mpox in Nigeria at the moment?
So you see, Mpox has been around for quite a while, but obviously, especially now that it has been declared a public health emergency of international concern, it's now in the news and everybody is talking about it. But I think you might recall about 2 years ago when we saw the first case with a boy in, whether it was just Bielsa or Port Harcourt. So it's been there, it's been increasing. There were a few cases before, but now obviously for many different reasons we're seeing many more cases popping up, and in many different parts of the country as well.
But for a layman, one would want to ask, how does it present itself?
So like very many other viral diseases, there are generalized symptoms. So basically that means that you have people complaining of headache and body aches. And of course, what everyone knows about this monkeypox virus is it causes rashes. They start off as small, as round, flat rashes, and now become those rashes filled with fluid. Obviously, there's also something called lymph node enlargement. We call it lymphadenopathy. So that is quite significant. If you've ever had a cold, and you feel a lump either around your ears, in your throat, that's a lymph node. So with monkeypox, it causes lymph nodes all over the body to become enlarged, and that's how you kind of differentiate it from other similar diseases.
Okay, I'd like to know, you did say it's a viral disease and it's affecting a number of the population, but I'd like to know the transmission mode of this particular disease.
So monkeypox, or Mpox as it's now called. So interestingly, it's the same thing. It was just changed from monkeypox to Mpox, just to make it more suitable culturally and traditionally. So it's transmitted usually through about 3 different means. People can get it from animals. So We don't yet know what animals are the reservoir. When we say reservoir, so what animal particularly is responsible for spreading it. But we know it's been found in monkeys, it's been found in rodents. So people who go around maybe hunting animals, skinning them, maybe not cooking them properly and eating them, are at risk of that. Then of course it can also be transmitted from person to person. So if you come very close, physical contact or intimate contact with somebody who has monkeypox, there's also a chance of getting it. Of course, the third one is that if any clothing or bedding or other material is soiled with the fluid from the rashes, and someone else gets in contact with it, that it can also be transmitted that way.
So you'd say it can be transmitted, say, through bodily fluids?
That's right.
Now, I'd like to know, is there a particular, say, age specification for this disease? Is it more common with children or adults or males or females? I just want us to clear that up.
So like most other diseases, this particular one can be caught by anybody. It is transmissible to anybody. Anybody can get it. But like I was saying, like other diseases as well, if somebody is less strong, so if their immune system, our immune system is that part of our body that protects us from the millions of viruses and bacteria that are floating around all the time. So if anybody has an immune system that is weak, so maybe somebody who has some other disease, cancer, HIV, children have undeveloped immune systems, so they are more likely to get it. Pregnant women also have lowered immunity, so they are more likely to get it. Older people as well. So they're more likely to get it, and it's more likely to be serious when those people get it. Okay,
you have stated the population that this disease is more likely to present. I'd like to know, what would you say should be the preventive or prevention measures that these people should take just so they can protect themselves?
So let me start by saying that monkeypox or Mpox is actually self-limiting. When most viral diseases are, if you get a viral disease or if anybody catches a viral disease, it will run its course and stop within a period of time. For Mpox, it's 2 to 4 weeks, unless of course there's a complication. So beyond that, how people can prevent it, obviously stay away from maybe poorly cooked meat or some of these rodents. I know a lot of people like bush meat. I got a question the other day about that. Treat it with care and treat it with all the seriousness that it deserves. Obviously, if somebody has symptoms and has rashes, it's always good to isolate. When you're around people, you cover up your skin, you cover up the lesions so that other people are not likely to get it. It can also be transmitted through close breathing. So wearing a face mask is also useful. But then, like everything else, our hygiene, our surroundings, our environment, keeping them clean will go a long way in helping with prevention.
Doctor, you'd agree with me, for cholera, some people would say it is more exacerbated during the rainy season. I'd like to know, is there a particular season that we would see more of these cases of Mpox?
That hasn't been determined. I think it just keeps transmitting so long as there's any host who is going to receive it. If somebody is infected and goes near someone else, it can easily transmit to the other person. So there's no seasonal variation or variety for it.
Earlier you said Mpox presents in 2 types, where we have the clade 1 and the clade 2. And right now in Nigeria, we're dealing with the clade 2 variation of the disease. But in the Democratic Republic of Congo, where it is more serious, they're dealing with the clade 1. I'd like to know, do you think, now that Nigeria just has confirmed 39 confirmed cases, do you think there is any chance that we may start to record the clade 1, which is more deadly? Or I just want to know what the dynamics are.
We're already recording clade 1, actually. With travel, you cannot stop transmission, and Nigerians can travel, and people also come to Nigeria. So the clade 1 is already circulating in Nigeria, just that it's not the predominant type. I think now that we have, it's been declared by the World Health Organization as a public health emergency, a lot more robust surveillance is going to start happening. And with that, we're going to be picking up a lot more cases. When we say 39 have been confirmed, that's just what has been confirmed by laboratory tests. There are probably thousands more in the community.
Okay, so I'd like to know what then are the treatment options? You know, it is not enough that we talk about the risk factors, you know, the types. Also, we would like to also know the treatment options available.
So like I said, it's a self-limiting disease. What we say about viruses, so for example, the cold virus, the flu virus, if you treat it, it lasts for 7 days. If you don't treat it, it lasts for 1 week. So basically, it will stop when it's going to stop it, when it runs its course. The only concern is if there's a complication. And a complication that can happen is like a bacterial infection. So the rashes can get, you know, when they break up, they can get infected with bacteria. So it's only at that time that someone may need antibiotics. Beyond that, treatment is isolation, treatment is taking care of the pain, covering it up, managing the symptoms, whether it's muscular aches or headaches. And beyond that, it will usually run its course and the person will get better on their own.
Okay, now let us look at vaccination. Is there any vaccination campaign in place for Mpox in Nigeria? And who would you say is eligible to receive the vaccines?
So let me start by saying I don't think there's any vaccination in place anywhere in Africa, actually. Vaccines have been developed, but they're mostly targeted towards contacts of people who have had it, and this is mostly in the Western world. But also maybe healthcare workers are given the vaccination. So for the general public, at the moment, I would say, from what I know, because I'm not working for government or any of the agencies, but from my own understanding, there's no vaccination campaign for Mpox at the moment.
Okay. For a lot of zoonotic diseases like this Mpox, I'd like to know what measures you think we should put in place for zoonotic diseases in general.
So there's a lot that can be done and probably should be done, and I would want to believe that the government, especially the Ministry of Health and other related parastatals, are working hard to ensure that we bring back something called surveillance. So going through, checking up on cases, managing them, recording them, knowing who their contacts are, limiting contact to ensure that we limit the spread of the disease. And I think that is really something that is important and needs to be put in place.
Now let us now look at the level of awareness. This disease, we had it 2 years ago and it is here again. Do you think Nigerians are really aware of this disease right now, even prior to now, say the preventive measures, and just so we don't keep having this outbreak year in, year out?
So we became aware of it 2 years ago, but it never really went away. It was always there. Those who got it knew that it was there. But it wasn't in the public space, that it was still being transmitted behind the scenes. As far as awareness goes, I think now that there's a lot of talk, I see so many articles in different types of media spaces regarding Mpox. So I think people are becoming aware. But I think it's also important that the health education is put out there by the relevant organizations and authorities, so that people understand what it is that we're dealing with. Because as much as, we always rely on government to do a lot, there's a supply side and demand side aspect to things. So when the people know what we're dealing with, we'll be able to take the right measures and, put in place what needs to be done to limit the transmission of the disease.
Doctor, you have stated that, we became aware of it 2 years ago, but it never really went away. But now I'd like to hear, what do you suggest should be the long-term plans? I mean, what long-term strategies should Nigeria have in place to prevent future outbreaks of Mpox?
So, like you mentioned, it's not the only zoonotic disease. and not also the only communicable disease that's out there. There are quite a lot of things that are there. I think the health system, the health sector is currently going through some kind of reform and transformation, and catching and putting in place strategies and means of addressing some of these communicable diseases is actually one of the key pillars of that reform strategy that is currently ongoing. So I think in the very near future we're going to be hearing a lot more about how things can be moved forward in a positive direction, and how not only the government but also the people, the accessors of all of these health services can do their own bit towards taking this thing out of the public space and reducing the transmissibility of it. But at the end of the day, I always like to say that we need to give people the information, so health education is very, very important and needs to be focused on.
Okay, doctor. Now let us look at global impact. You'd recall for COVID-19, it impacted globally. We saw lives being completely shut down. We saw the economies shut down. What do you think would be the global impact of this particular disease? I mean, it's already spreading in Africa. It's
spreading in Africa. It's also spreading in other parts of the world. And COVID wasn't particularly pleasant, but Mpox is actually quite an unsightly disease. The fact that you see the World Health Organization coming out, having emergency meetings and declaring it a public health emergency of international concern, then you know that things are being put in place. Whether those things and strategies include vaccinations and making them available not only to the developed world but also to the developing world, we will have to wait and see. But I believe that a lot is going on behind the scenes that will start to translate in the very near future.
For any particular disease, of course, we'll need the input of our health workers. Now, let us bring it down to the health workers. How do you think health workers can protect themselves? We talked about how easily this disease can be transmitted.
So, health workers, I believe, know the import of taking precautionary measures, whether that is wearing masks, wearing gloves, sanitizing the environment that they are in. But I think I'll come back still to educating ourselves. If people know, and the health workers especially know how transmissible it is, they will put in place for themselves personally all the measures that are required to protect themselves as much as possible. But also the system, the hospitals, the healthcare sector, I think would probably be looking into how to protect the health workers, especially in the facilities where they come across diseases like this. Like I said, it's not the only one. There are very, very many of them. This is the one that is just gaining public light at the moment, but there are very many others.
Doctor, you'd agree with me that more than half of the number of states we have in Nigeria is already accounting cases for suspected cases and also confirmed cases of the Mpox. I'd like to know, how do you think we can curb this transmission from state to state?
It will be hard, and it's not just half. It's like 32 out of the 36 and FCT. So it's gone all the way. People travel, and you can't stop people from traveling. One of the things with Mpox is that it actually, some people just don't have symptoms. Some people don't have rashes. Some people don't have anything that will show you that they're carrying the virus and they're transmitting it. So we can only individually arm ourselves with the information and the knowledge that is required. And if perchance, similar to chickenpox, right? Somebody contracts it, take the necessary measures to, get yourself the right kind of treatment, isolate, knowing that within 2 to 4 weeks, it'll run its course.
Doctor, you just stated that some people may present with the symptoms and others may not even be aware that they have this virus present in their systems. I'd like to know, at what point do you think this disease becomes, this virus poses danger and that the person carrying it, I'm talking about complications.
So like I was saying earlier, complications can happen, Usually, when the rashes run their course, they break up, fluid flows out. If we're not in a clean environment, if we don't keep it as clean and dry as possible, it can become infected. So that's usually the complication. Obviously, like I said, if somebody has some other illnesses in the background, so basically their immune system is compromised, they may come down with more serious disease. In that case, your healthcare worker and your healthcare facility should be able to handle it appropriately.
Doctor, I'm very particular about this. I know that a lot of diseases are being transmitted primarily through our hands. I'd like to know, why is it important for Mpox now that we keep our hands clean, wash with detergents or, alcohol-based hand sanitizers? I just want to know why it is very necessary that we keep our hands clean.
Because this disease, Mpox particularly, you can actually use your hands to spread it to different parts of your own body, not even to other people. So when the fluid comes out and you allow it to touch another part of the skin, usually by scratching, moving your hands, touching doorknobs and all of these things, you yourself can get an even more serious disease. Not to even talk of, spreading it to other people. So obviously washing hands and using sanitizers appropriately can limit that spread.
I'd like to know, Doctor, what other additional, information would you like to add to the already existing one?
Well, like I said, it's more about educating ourselves. And I think I will repeat myself and say the healthcare providers, I'm talking of government here, and any other information agency, needs to do a lot more in providing information to people in a way that they can understand and absorb. So it's not for us to come as people in the health sector to come top down and be saying big words that people can't understand, but to break it down, so that people understand. Nobody wants to get Mpox actually. I don't think anybody wants to get that unsightly disease. So if people understand how they can protect themselves, probably a lot more people will take the required measures to do that.
Doctor, but you'd agree with me that there is one thing about providing information, then there's another thing about people accepting this information and putting it to use. How would you advise people who have actually gotten this information to put it to use so that they don't find themselves wanting?
Well, there's very little you can do. I think the job of those in charge is to put out the information. What every single one of us does with that information is entirely up to us, but if beyond what individuals do, there are systems in place, surveillance systems, treatment systems, to make sure that you can't take every disease out of the environment. You can't. You can just keep it within a manageable amount, a manageable number. And if we're able to do that, I think it will go a long way in reassuring everyone and reducing the spread of diseases like monkeypox. Okay,
you talked about the environmental factor of this disease. I'd like to know, it is a zoonotic disease. I'd like to know the role of animals here. What more should we do for those who are, say, cattle rearers or people who actually participate in animal production? And also, what should we do better for environment, just so we don't have transmission of this disease from animals, the environment, and then to persons?
Okay, so we know it's a zoonotic disease, right? It hasn't been determined which animals are the reservoirs. So when I say that, we don't know which animals are actually carrying the virus and transmitting it. But it hasn't really been found amongst, some of the larger animals like cows and those things. It's been found mostly in rodents, bush rat, also in the monkey, some others that are mostly in the bushes. I think, it just makes sense that we should just limit the contact that we have with some of these animals unnecessarily. If you're keeping a monkey as a pet, then you kind of know that you're putting yourself up for trouble, right? Same with, rats and other things. So, as much as possible, keep away from them. As time goes on, we'll probably understand a lot more better what animals are reservoirs, natural reservoirs. And then at that time, the more information can be put out as to how we can manage the transmission.
Thank you so much, Dr. Amina, for your input on the program.
Thank you very much, Aisha. It was a pleasure being here.
Mpox is a growing concern in Nigeria, but with the right knowledge, treatment and preventive measures, we can control the spread and protect our communities. Before we go, we'll leave you with some facts you probably didn't know about Mpox. And that concludes this week's episode of the program, Healthy Living on Trust Television. For comments, contributions, and suggestions, do well to subscribe to all Trust TV social media handles. Download the Trust TV app on iOS and Android devices across their respective stores and get live updates on the YouTube live stream and the website. Join us next time as we continue to explore subjects crucial to your health and well-being. I am Aisha Salihu. Thank you so much for your time. Join us again.